medication, administration of suppository. Okay, this is a medication station. So basically what you need to do, you always need to start reading the scenario that is given to you. Okay, once you finish reading the scenario, you will also have the prescription chart with you. Reading the scenario, you start with the pre-checks. So let us start reading the scenario, do the pre-checks, and then we will come to the medication administration chart reading. Okay, so let me read the scenario first. So I'm just reading the scenario. Okay, now I'm going to start. So I'm going to start with pre-checks. So scene is safe to approach, no hazards present. I will close the curtains to provide privacy and dignity. I will do my hand washing as per the 7 steps of WHO guidelines, palm to palm, back of the palm, interlacing the fingers and vice versa, interlocking the fingers and vice versa, fingertips, left thumb, right thumb, left wrist, right wrist. I will wait for 30 seconds to dry. Good morning, Mrs. Mary Smith. My name is Asha. I am the nurse looking after you today. Can I call you Mary? Is that okay? Yes, thank you, Mary. So before I proceed, let me just tell you, I'm here to insert your suppository as per your doctor's prescription, so I can help you to open your bowels. Is that okay? So I'm just going to confirm your identity, please, Mary. Can I please confirm your full name? Can you confirm the full name for me, please? Mary Smith, thank you. Can I please confirm your date of birth? Okay, so can I please take it with your wristband? Your name is Mary Smith. Your date of birth is 31/10/1969. Your hospital number is 405321. Thank you, Mary. Can I check, are you allergic to anything? Very important. Please ask the allergy status of the patient. Okay. Thank you, Mary. Are you in any pain or discomfort? No, thank you. So I'm just going to collect all the equipment and then I will be back. This is your call bell, and if there is anything, please do let me know. Thank you, Mary. So I'm going to read the prescription for this. So surname Smith, forename is Mary, date of birth is 31/10/1969, hospital number is 12345, ward A&E, date of admission is today, height is 1.57, weight is 74, body surface area is 1.80, time of admission is 10 a.m. The drug prescribed is glycerin, suppositories, date today, dose per gram, frequency is start, PR, route is PR, duration is start date is today, finish date is plus 6 days. Always look for start date if there is any. Okay, because it's really important. Okay, I can see the prescriber's signature and bleep number and print name. So the prescription is clear, valid and legible, and I'm happy to proceed with this prescription. So tip number 2 in the medication skill station, read the entire prescription, make sure the prescription chart is valid and legible. Now I can proceed. If the prescription chart is not legible, can you proceed? No. For example, if there is no doctor signature, you can't proceed. Okay, now I'm going to take my equipment. So first of all, I will need the glycerin suppositories. Glycerin suppositories is usually 4 gram. So verbalize this. Glycerin suppositories 4 gram. Expired date is 7/20/29. Sometimes they can also keep glycerol suppositories in a bottle labeled as glycerol suppositories 4 gram, expiry date is 7/20/27. If it is in a bottle, please do verbalize that in the bottle like we did in the implementation station. If it is in a packet, please do verbalize that it is in the packet. Sometimes they may keep just plain glycerol suppositories opened. So if that's the case also, you please mention this is glycerol suppositories 4 gram and I will ensure it is within the expiry date. So make sure that you verbalize the name, dose and the expiry date. So that is all good to go. I will need a gauze. Why? Just in case if there is anything to be cleaned. So I will need the gauze. So I can see the expiry date is 1/20/29. The lot number is 5AF. I'm happy to use it. I will need a bowl of warm water to lubricate my suppository, or else I will need a lubricating jelly if it is available. If the lubricating jelly you are taking, always make sure you take the expiry date of the lubricating jelly. Okay, now I have got everything ready. I will just have a spare pair of gloves so I can use it for my procedure. I will now do my hand washing as per the 7 steps of WHO guidelines. Palm to palm, back of the palm, interlacing, locking, fingertips, fingertip, left thumb, right thumb. Wait for 30 seconds to dry. I'm going to put my apron. So if it is warm out, take it from the wall. Okay. So I'm putting my apron, okay, and I'm putting my gloves. So I'm all good to go to my patient. If you are using gloves and apron, before you collect equipment, make sure you change the gloves and verbalize it is the apron is clean. So I'll keep the same apron. Okay. Now I'm going with the trolley to my patient. Okay. Hi Mary, I'm back with all my equipment. So as I have told you before, I'm here to insert your suppository. What is the next thing you need to do? Ask the identification again. Can I please confirm your full name? Mary Smith. Can I please confirm your date of birth? Don't say, are you Mary Smith? Anybody can say yes or no. So confirm it. Okay. Date of birth is 31/10/1969. Can I check it with your wristband? Your name is Mary Smith. Your date of birth is 31/10/1969. Hospital number is 12345. An important thing. Are you allergic to anything? No. Thank you very much, Mary. I'm now happy to proceed. Okay. Now, always make sure the position of the patient. Okay. So, what should be the position? So, let me tell you, the position should be in the left lateral position. Okay. So, remember, we are going to insert suppository. So, left lateral position with knees flexed. Okay. Knees flexed and buttocks to the edge of the bed. So this is the position. Remember, you must verbalize this position, but you should not touch the mannequin there in the exam room for health and safety reasons. So you must verbalize. The mannequin will be positioned back. So I will make sure my patient is in the left lateral position with knees flexed and buttocks to the edge of the bed. I will also ensure my patient has enough privacy and dignity, because this is a procedure that we are going to expose private part of my patient. So I will just confirm that once again. Okay, Mary, I will play. I can see there is an incontinent sheets already here. There is no incontinent sheet. I can provide you one. Okay, but if that, since it's one is there, I'm not doing it anymore. Okay, Mary, can I please ask you to expose the the rectal area so I can insert my suppository? Can you please down your trousers and expose the private area? Is that okay, Mary? Yes. So we can do that. If you are doing it, kindly change the gloves. If the assessor or somebody else is helping you, then you don't have to change the gloves. Okay. Or verbalize, I will change the gloves. So I can see the first thing as soon as you expose the private part is check for any discharge, any rectal prolapse, any hemorrhoids, anything unusual. So I can say there is no rectal prolapse, no hemorrhoids, no discharge, no signs of infection. It is all good to go. It is clean to proceed. That's the first thing that you need to do. That is check the anal area. Clear? Okay. Then you can do, the next thing will be to tell Mary. So Mary, I'm going to insert the suppository through your rectum. While I'm inserting, you'll use my 2 fingers to separate the buttocks. Is that okay? Because you're going to touch the patient. So remember, always gain consent before you touch the patient. So I'm going to use 2 fingers to separate the buttocks. Is that okay? Yes. Okay. Now I'm going to take my suppository. So my patient is all ready. So I'm going to take my suppository. So if it is in open box, that saves a lot of time. If it is not opened, please make sure that you need to open this. Okay. Most probably it is a good idea to keep it open so that you can avoid later any complications. So I'm going to open the suppository. Okay. So I'm going to open the suppository. The suppository looks like this. I hope you all know this. Yeah. And I'm going to lubricate the suppository. I will just have the gauze in hand opened as well so that I can give it later. If you are using the lubricating gel, make sure you put the lubricating gel to the gauze and lubricate it, or else use warm water. Okay, so Mary, I'm going to insert the suppository. As I've said, I'm touching your buttocks, rectal part, and I'm inserting the suppository. Mary, can you take a deep breath in? Sorry. Okay, deep breathe in, Mary. Okay, I will insert the suppository while she's hold the breath for 2 to 4, up to 4 centimeters. Okay, so suppository is now gone. I will clean the course with any excessive discharge and everything. I will clean the course. Mary, are you comfortable? Okay, I'll make sure I have paid any privacy and dignity for Mary. Okay, I'm just going to take off the gloves since it's contaminated. Okay, I'm sorry. I will put it in the bin. and I will take off the apron as well. Always make sure my patient is comfortable before taking off. Now I need to give health education to Mary, so this will go in the bin as well. Okay, so Mary, I will now need to tell you, I'll do my hand washing quickly. So Mary, there are 3 points I have to tell after the suppository. The first point is retain suppository for 20 minutes. Why? Why should the patient keep suppository for 20 minutes minimum? So that the suppository works. Okay, the next thing is we can expect some discharge. That is quite normal because the suppository melt. Alert the patient. Because the patient may be surprised if they see a discharge all of a sudden. So you can expect some discharge because the suppository is melting. Also, you have the toilet and commode nearby. So you can use the toilet or commode or bedpan, whichever is required. Okay, and this is your call bell, Mary, if you need any help. Okay, anything else I can do for you? No. Always document. Okay, so you must sign. Okay, if it's a PRN medication or a stat medicine, you put the date, time, and your signature. Okay, Mary, thank you so much for your cooperation.